It's interesting to look back at the, at least the 12 years I've attended this meeting to look at how imaging has evolved. And, originally we were trying to justify all this new imaging. We called it next generation imaging, now molecular targeted imaging. And now we're having really robust discussions on how it's impacting how we manage patients, which is really complicated because all of our clinical trials didn't incorporate PSMA PET into their trials. So I think we're going to talk about oligometastatic disease, but I think it's important to establish whether or not you believe in oligometastatic disease or not. And I'll be the first to say that my belief in this is kind of waning. And I think maybe the terminology needs to change. This is a slide from Rob Reiter that he gave this amazing presentation at the APC meeting maybe 5-6 years ago on oligometastatic disease. And I was a believer. This is great. We have an opportunity to potentially cure some patients, and imaging is going to be a big part of that. I will say, though, that my belief in this is kind of waning because, as we heard about before, I don't have a PhD in engineering from the University of Michigan. I did sleep at Holiday Inn Express, and I, too, agree that using a number 5 is not enough to say. It's just too basic. It just doesn't make sense. And I think we need to move past that and kind of what Dr. Hahn was saying. I think we need to think more about biology. And to me, oligometastatic disease, at least in the hormone-sensitive setting, it's metastatic hormone-sensitive prostate cancer, and where are we putting it? And I think we need to think about it in terms of biology and not just number. What are the goals for treating oligometastatic disease? I think it was really nice early on to hear conversations about shared decision-making and understanding what the patient's needs are. Some patients, maybe sexual health is more important. For some patients, they just want to do anything, just to throw the kitchen sink. So I think it's important to have those discussions and figure out what